Dana Cobb. I'm one of the regional program administrators and the Northwest Regional Coordinator for the Tennessee Commission on Children and Youth. And we want to welcome everybody here today for Health for All. Education is the best medicine. We want to particularly thank Susan Cope and her contacts in her region for bringing this idea and putting this together. So we have some amazing speakers that is going to give some of the latest data. We have some great information that's going to be shared about opportunities for, accessing health care. And there's also going to be some sobering statistics that Kylie Graves will share when it comes to the kids count data. So again, we welcome you. Before we get into our program, I did want to, tell you a little about how these trainings come about. There is a regional coordinator in each of the 9 regions across the state of Tennessee. In our Memphis-Shelby County region, it is Gwendolyn Wright. And Gwen has served in that capacity for many years and does a phenomenal job. Then in the Southwest region is Jerry Moore, and Jerry is our tech guru, the one that we always go to for, how do we do this? And then I serve the Northwest, so we make up the West region. In the middle region, we have Susan Cope, who is, of course, the Mid-Cumberland, Nashville, and all of those other fastly growing metropolitan cities around Nashville. And then we have Christy Paling, who is in the Upper Cumberland region, and that's around Cookeville. And then we have a new coordinator down in South Central, which is Columbia, and that is Carla Walker. And if you have not met Carla yet and you live in that region, we'll put some emails up and then you can access information. Unfortunately, Carla already had a vacation planned and she is on vacation today. Then up in the East region, we have Lindsay Cody. And Lindsay is the regional program manager, the second one, and also the East Tennessee regional coordinator. And up in the Upper East quadrant up there in those beautiful mountains up there is Jill Stott. And our newest addition to our family is Marissa Player Montgomery. And we are, she just started this week, and she will be serving the Chattanooga area. She has a lot of contacts, and she has already made lots of connections prior to joining us. And so if you're in that area, please make a point to hook up with Marissa, because I know she wants to meet each and every one of you. So again, we're excited you're here. We know it's Friday. And I don't want to take up too much time, but I did want to let you know who we are that put this on. The other thing is we are membership organizations. We charge a small nominal fee for each of our regional councils, and that is how we pay for speakers and food and venue space and projects out in our communities. So when you get those membership forms, know that it's going to good work. Okay. So I am going to switch and I'm going to talk about our first speaker. Our first speaker is Kylie Graves, and Kylie works for the Tennessee Commission on Children and Youth, and she is our communication and policy specialist, and she has just done incredible work around Kids Count and the county profiles and other work. She is also a tech guru, so we love Kylie. And so Kylie, I am going to turn it over to you to talk about Kids Count State of the Child.
Sounds great. Let me share my screen real quick. Good morning, y'all. Oh, there we go. Good morning, y'all. Okay, so let me get this shared. Let's get this into presentation mode from the beginning. Okay, so Like she said, my name is Kylie Graves. I am the Communications and Policy Specialist for the Tennessee Commission on Children and Youth. And so part of what I do is I work on our kids count data. So we are a partner with the Annie E. Casey Foundation, which is a national foundation. They do a lot of collection around data. They do national releases. And so part of what we do is we contribute to that data. And then alongside their national releases, we do an annual State of the Child report, which is what I'll be highlighting here. And then additionally, we do county profiles where we look at county level data and rank the Tennessee counties against one another. And so we released the State of the Child in December, and then we released the county profiles in March. Today, I'm going to be focusing mainly on the State of the Child data. When you start adding in some of the county level data that's from different years, it gets really confusing to keep track of everything. So we're going to focus on State of the Child. I'll go over some of the data related to health that was in the report. And then because we're in the pandemic and everything is consistently evolving and we're gaining new data, I'll highlight some of the additional research that's come out since we developed the report and what that is looking like for us. So for overall health, just looking at Tennessee data, and the majority of the data that I'm sharing is going to span from 2019 to 2021. In the report, it'll highlight specifically what it is, and if there's anything in particular, let me know and I can answer that. We did struggle a little bit with collecting data due to the pandemic. Some of the Census Bureau typical releases were delayed due to some disruptions from the pandemic, and so we had to find other sources, and that prevented us from comparing to previous years. So some of this data is new, but looking at overall health for Tennessee kids, more than 1 in 5 Tennessee children had special health care needs. In K-12, the most common chronic illness or disability diagnosis was asthma, ADHD or ADD, and severe allergies. When we look at access to care and treatment, talking about mental health, more than half of Tennessee's children with a mental or behavioral condition did not receive treatment or counseling. And that's a very alarming statistic because we're going to talk more about, when we talk about mental health in Tennessee, the challenges with even getting a diagnosis or having a diagnosed mental health condition for children. And so there's already a large group that's undiagnosed, and only 50% of Tennessee's children who have gotten that diagnosis received treatment. Additionally, so let me move this screen. I don't know if that's blocking y'all or not. So in 2020, 78% of Tennessee children had received the full recommended series of vaccines at 24 months. And then despite the risks that the flu presents to children under 2 and the benefits to them of the influenza vaccine, in 2020, only half of Tennessee children under 2 had received at least 1 dose of the flu vaccine, and less than 1 in 3 received all 3 recommended doses for that young age. There we go. So this graph here is a national graph. So this is not Tennessee specific data, but what this is looking at is the drop in pediatric care due to the pandemic. And so the blue line is a typical year trend averaged out across the year, and then orange is 2020. And so we see that at the beginning in 2020, it was tracking similarly to previous years. And then really in that 12th week or so of 2020, we see a significant drop in pediatric care and pediatric visits. And it climbs a little bit throughout the summer, but then we see that drop again throughout the year. And so in Tennessee, there was a 62% decline in pediatric visits in April 2020 compared to the month prior. And additionally, in April 2020, Tennessee vaccination rate for children was 39% lower than April of 19, so than the previous year. Well child visits and immunizations are critical to supporting health and safety child development. So it's really important that we catch up on those missed vaccines. And so when we talk about insurance coverage, half of Tennessee's youth are insured through TennCare, and 80% of uninsured Tennesseans reported being uninsured because they could not afford health insurance. So in fall of 2020, a Vanderbilt Child Health Poll found that the percentage of uninsured children in Tennessee had more than doubled from 4% in 2019 to 9% in 2020. This was largely driven because of a loss of employment, which then led to a loss of private insurance. So the percentage of privately insured children in that time decreased from 56% to 47%. So we can see how the impact of the pandemic and the loss of employment through parents really impacted children's healthcare access. Additionally, in 2019, so pre-pandemic, over 7 in 10 uninsured children remained uninsured, even though they were eligible for CoverKids or TennCare. And so when we look at outreach, it's really important that we're letting those who are eligible know and communicating that in an equitable and accessible way. So looking at challenges with language barrier, challenges with literacy, or challenges with access to internet, access to broadband, things of that nature. And then in fall 2020, the Vanderbilt Child Health Poll found that 1 in 5 parents in these programs, so TennCare or CoverKids, reported a loss of coverage over the last 2 years, with more than a third of those attributing a loss to a paperwork issue. And so we know how important it is for children to regularly receive healthcare and regularly go to those well child visits. And a disruption in coverage can really impact a child being able to visit the doctor and cause delays in those vaccinations or other things that are really important for children. And so Tennessee currently has a 12-month continuous eligibility for CoverKids, and this allows children to remain on the program for a full 12 months after enrollment, despite any temporary fluctuations in their caregiver's income. Due to the COVID-19 public health emergency, this eligibility has been extended to all Medicaid recipients. But after the pandemic health emergency expires, which we'll talk about a little bit later, children with TennCare coverage won't have this protection anymore, and they'll be more vulnerable to coverage gaps that may occur due to fluctuations in unemployment or paperwork issues. And so to ensure coverage for all youth, Tennessee should implement a 12-month continuous eligibility for TennCare in addition to the eligibility that exists for CoverKids, particularly since lower income individuals are more likely to face those fluctuations in income, whether that be an hourly decrease or increase, loss of unemployment, or being laid off. So when we look at mental health in Tennessee, Mental Health America ranks the states. Tennessee struggles compared to the other states in DC, with youth mental health at 40th in the nation, and then access to care, specifically access to mental health care at 45th in the nation. And so this graph here in 2019 and 2020, Vanderbilt Child Health Poll asked parents if their children aged 6 through 7 had been diagnosed by a mental health professional for any of these conditions. And so that's what you see in blue. And then additionally, they had asked the parents if they were concerned that their child may have one of the conditions but has not yet been diagnosed. That's what you see in the orange. And so Vanderbilt Child Health Poll reported that while approximately 1 in 10 children have been diagnosed with anxiety, and this is the children aged 6 through 7, and another 1 in 5 parents were concerned that their child had undiagnosed anxiety. And then when we look at teen mental health, this data is pre-pandemic. It is from 2019 with the Behavioral Risk Factor Survey. And so in 2019, 15.5% of Tennessee high school students made a plan within the last year of how they would attempt suicide. And in that same survey, 1 in 10 reported attempting suicide. And I think the thing that's really important to remember here is that this is just asking them about within the last year. So the last 12 months before the survey, 1 in 10 students in Tennessee reported that they actually attempted suicide. And then additionally, looking back at that behavioral health survey from Vanderbilt Child Health Poll, parents reported that of the parents who had concerns that their children had an undiagnosed illness, more than 1 in 10 were worried about their children having suicidal thoughts or intentions. The parents are kind of seeing this appear in their children. And then additionally, 1 in 10 parents weren't confident in their ability to identify the warning signs of suicide or what to do. The highest risk factors in this survey were being female, being Hispanic or Latino, or being a sophomore, and those were about 18%. And the number of students who made a plan about how they would attempt suicide has increased by 50% since 2007. So we were already seeing a decline in teen mental health before the pandemic happened. And so nationally, Tennessee does really well in terms of teen substance use. Teen substance use in Tennessee is on the decline and lower than the national average, with the exception of tobacco. Tennessee teens use tobacco at a higher rate than the national average. But there has been an alarming increase in fatal overdoses, primarily due to fentanyl. Fentanyl was involved in 80% of overdoses among Tennesseans 15 to 24. Since 2017, the number of youth and young adult overdoses from fentanyl has increased by 230%. And there was additionally 4,000 non-fatal overdoses due to fentanyl. And so looking at access to care, access to substance use treatment, access to preventative measures, things like that. And then additionally, 15% of Tennessee high school students reported having ridden in a car within the last month where the driver had been drinking alcohol, which is a risk factor and a safety issue. And so then looking at maternal mortality, we're looking specifically in terms of insurance coverage. There's additional data in the report about rates of maternal mortality, different risk factors. We highlight the maternal mortality disparities among Black women. But of all Tennessee-associated deaths, more than 2 out of 3 were covered by TennCare after birth. In general, TennCare covers about 50% of children in the state and about 50% of births in the state. And so when we look at the time frame, the maternal mortality report looks at death among pregnant women or mothers after birth from conception until 12 months after. And so 61% of deaths occurred between 1.5 months to 12 months after birth. So that was the highest fatality time period. And previously, TennCare coverage for pregnant women expired 60 days after birth, so just 2 weeks into the most fatal time period. The pregnancy-associated mortality ratio for a woman on TennCare was 2.5 times higher than those on private insurance. And additionally, a new pilot program that went into effect just a few weeks ago will extend those benefits for 12 months. And so we hope to see a reduction in these maternal deaths because about 80% of these were found to be preventable. And dental care, 1 in 4 Tennesseans children did not receive preventative dental care in 2019 to 2020. But one area that Tennessee does really well in is community water fluoridation. So it's a safe, equitable, and cost-effective way to support oral health across a community by adding a small percentage of fluoride into tap water. And 8 out of 9 Tennesseans are served by community water fluoridation. And that's higher than the national average. And the nation has set a goal, and Tennessee has already outpaced that goal. So we're doing really well there. It's considered, community water fluoridation is considered one of the top public health achievements of the 20th century. And then additionally, ensuring access to dental care for those who are pregnant or just had a baby is critical to the health of the parent and the child because bacteria is passed both in utero and after birth from the mother to the child and can cause issues with early birth or different illnesses. And so the expansion that allowed Tennesseans to remain on TennCare 12 months after birth has also expanded and included dental coverage as well. And so new research that has come out, the Vanderbilt Child Health Poll updated their results with some of the data that we talked about. So in the original data in the report, we talked about how the number of uninsured children had gone from 4% to 9% in 2020. That number has decreased and 6% were uninsured in 2021. So we're seeing that come back down, which is encouraging. Previously on the report, 1 in 10 children were diagnosed with anxiety, that 6 and 8 range. But now that is 1 in 7. So we're seeing an increase in diagnosis and anxiety. Additionally, Vanderbilt Health Poll found that the parental trust in vaccinations has decreased by 10% since 2020, but the trust in healthcare providers as a resource has increased, which is encouraging. And then CDC recently released their ABES data. And so nationally, approximately 63% of high school females reported experiencing abuse by their caregiver during the pandemic. That's specific to emotional abuse. And then additionally, they looked at mental health data among high schoolers. And this is all national data. We don't have the specifics for Tennessee yet. But 1 in 3 high schoolers reported having poor mental health for most of the pandemic. In the 12 months preceding the survey, 44% felt persistent feelings of sadness or hopelessness. And these feelings were most prominent among gay, lesbian, or bisexual students, with more than 3 out of 4 reporting persistent sadness or hopelessness. And those same students were more likely, 3 times more likely to report having seriously considered attempting suicide in the last 12 months. When we look at substance use, during January to June of 2021, 31% of high school students reported current use of any tobacco, alcohol, or marijuana, or current misuse of prescription opioids. Current alcohol use was about 20%, electronic vapor or vapes or e-cigarettes was about 15%, and marijuana use was about 12%. And these were more prevalent than prescription opioid misuse, which was about 4%. And then approximately 1/3 of students who used vapes or electronic cigarettes did so daily. And about 22%, so a little more than 1 in 5 students who drank alcohol did so more than 6 times within the last month. And then additionally, we talked about Medicaid coverage and that continuous eligibility. And so currently that is still in place. It was set to expire April 15th, but they did extend the public health emergency. So that's in effect for another 90 days until they decide whether they will extend that or not. And so due to the public health emergency, Medicaid enrollment by the end of November had grown about 20% since the beginning of the pandemic. And as many as 1 in 4 Americans are now insured by Medicaid. After the pandemic, there's about 15% of Tennesseans who are currently covered who may end up losing their coverage. So that is the Tennessee data around health. And I think we have time for questions later. Is that correct?
Yes, Kylie, that's correct.
Okay, great. Thank you so much.
Thank you so much, Kylie. We appreciate the information that you shared with us. Now I have the great honor to introduce my friends and our co-presenters from the Family and Children Services. I will introduce all 4 of them at this time, and then they will do their presentations. Aida Whitfield is the manager of the Healthcare Access Affordable Care Act program. She holds a Master of Public Service Management degree from Cumberland University. Ida, she worked as a certified navigator since the beginning of the healthcare marketplace in 2013, and in 2019 she was promoted to her current position, where she now manages a team of 17 health insurance navigators. As an Ethiopian-born American, her personal background has influenced her commitment to serve at-risk and unserved populations in her community. Emily Fauché is the manager of Connecting Kids to Coverage program at Family and Children Services. Connecting Kids to Coverage is a statewide program that helps families with enrollment, renewal, and other assistance for TennCare, CoverKids, and Marketplace insurance. Sharon Barker is a certified navigator for CoverKids Tennessee. She is a native Nashvilleian and a graduate of the University of Tennessee, Knoxville, with a BS in Business Administration. She has worked as a navigator since 2013 and is currently the Get Covered Tennessee Outreach Coordinator, as well as a certified ACES facilitator through Building Strong Brains in Tennessee. Sharon also serves as Vice President of my Mid-Cumberland Council on Children and Youth. Leah James is a lead healthcare navigator for Family and Children's Services Get Covered Tennessee program serving the greater Memphis region. She graduated with a Bachelor in Health Science from Berea College in 2010. Leah has worked as a navigator since the inception of the Affordable Act Insurance Marketplace in 2013. As a native Memphian, she is passionate about connecting the community to quality, affordable health care and serving at-risk and underserved populations. We thank them for being here today, and I'll turn the program over to you, Ms. Whitfield.
Thank you, Susan. I'll go ahead and share my screen. You guys able to see my screen?
Yes, ma'am.
Well, thank you, Susan, again, so much for inviting us to this wonderful event. And also, I would like to thank everyone for being here with us. Again, my name is Ida Whitfield. I am the Healthcare Access Manager for the Affordable Care Act program with Family and Children Service. And before I start talking about our program, I would like to, before I start talking about our Get Covered Tennessee program and the service we provide, I'd like to give you brief information about our organization. So Family and Children Service is one of the oldest nonprofit in Nashville. It is founded in 1943 by volunteers who help find adoptive homes for children orphaned by World War II. The main focus of the organization has been working with vulnerable children and families, and the early years, counseling and adoption service were two of the main programs our organization focused on. Then in the 80s, our counseling program expanded and expanded its charitable and private practice and was able to serve thousands of Tennesseans. And this is even prior to health insurance plan start to cover mental health within their coverage. So as the need of the community changed and FCS also then shift gear to meet the need of our clients. So as a result, today our organization offers different safety social service services directly to clients and through our many partners and collaboration and referral networks. These are some of the programs and services that our organization offers. Currently, counseling and crisis service, which also include family-focused solution and survivor of suicide laws. We do have the child welfare and community service, which include Davidson County Related Caregiver Program, Family Resource Center, Fostering Resilient Community, which Sharon was leading. We have Windy, Wonderful Kids, and also Confronting Adversity for Future Empowerment. Those are under the Child Welfare and Community Service. And then we do have our program, the Healthcare Access Service, which we'll be focusing on today on our presentation. So under the Healthcare Access Service, we have the Get Covered Tennessee program, which includes the Affordable Care Act grant and also the Connecting Kids to Coverage grant. And then we have the Health Assist program and then also the Language Service program. So here is a little background history of the Get Covered Tennessee program. So Get Covered Tennessee is a statewide consortium led by Family and Children Service to provide outreach about Affordable Care Act and also facilitate enrollment through the marketplace. So when we start in 2015, the group had 11 nonprofits serving the whole state. And this is back in 2015. And we continued the service. And then in 2018, our funding was cut tremendously. So we were forced to almost dissolve the consortium, and Family and Children Service was then the only leading navigator agency serving the whole state. And also our outreach and enrollment effort was greatly impacted because of the budget cut, but FCS was able to serve and continue serving the whole state with limited staff for the next 3 years after 2018. So current history, things has changed differently because of the current administration plan to strengthen the Affordable Care Act. Funding for Navigator Agency has increased tremendously. So we then, because of that, we were able to start rebuilding the consortium. So currently we have 3 partner agency, also sub-grantees under the Get Covered program. One is Matthew Walker Comprehensive Health Center. We have Cherokee Health System, Matthew Walker Comprehensive Health Center here in the Middle Tennessee area. We have Cherokee Health System in the Knoxville region. And also we have Appalachian Mountain Project Access in East Tennessee. We are also able to increase our staff within Family and Children Service. So we now have 25 federally certified navigators. And we also have 9 healthcare access specialists who are serving the whole state. We have in-person presence in Nashville. We have navigators and healthcare specialists in Cookeville, Lewisburg, Chattanooga, Cleveland, Knoxville, Jackson, Dyersburg, Memphis, and Johnson City. And we're now adding one more navigator for the Clarksville area. So as I mentioned earlier, under Get Covered Tennessee, we have 2 programs that are funded by Center for Medicare and Medicaid Services, CMS, which is the Affordable Care Act program, and also the Connecting Kids to Coverage program. So under the Affordable Care Act program, we have federally certified navigators who help consumer with marketplace enrollment process. The navigators' duty also include providing fair, impartial information to help consumer understand their healthcare insurance options so that they can make informed decision when choosing a health coverage plan. You may have heard about agents and brokers who are kind of doing similar work, but however, they are paid by the insurance company, so they are more likely to pursue people into signing up for a plan that is not in their best interest. Navigators also conduct outreach and education, outreach to educate consumers about Affordable Care Act and available coverage through the marketplace. So they attend different community events, health fair, meetings, and trainings, and wonderful gathering like we have today. And they provide post-enrollment assistance to help a client resolve the issue after even enrolling in the marketplace. They help people file an appeal with the marketplace if needed or with the insurance company. They help resolve data matching issue, which we usually see. Sometimes clients may have to submit supporting documents in regards to their income or in regards to their immigration status. So our navigators assist with them. We also assist, the navigators also assist with updating information on application if need to be throughout, the coverage year. They also provide cultural and linguistically appropriate service by providing interpretation of interpreters if there's a language need. And they also distribute information like outreach materials in language other than English, depending on the needs of the clients that we are serving. So similar to the Affordable Care Act program navigators, our Connecting Kids to Coverage specialists help children and family apply for TennCare and CoverKids through the TennCare Connect website. So Kylie had mentioned so many things earlier, which really is important as far as, having children getting appropriate coverage throughout the year. And she also mentioned issues why we see a lot of uninsured children because of, issue understanding the whole application process or even, understanding the application all in general. So that's why our team comes and provide and guide everyone who needs coverage if it is TennCare or Marketplace. Our specialists can sit with the individual and really go through the application. And also they provide fair and unbiased information. And they conduct outreach, the Connecting Kids Coverage team. And also, again, our work doesn't just end at the enrollment. After enrollment, we assist with, again, post-enrollment process. We refer those who are not eligible for TennCare to other resources or, other whatever need they have, we try to provide it besides just, providing enrollments. Again, similar to the navigators, our healthcare access specialists provide culturally and linguistically appropriate service and offer interpretation for those with limited English proficiency. They also provide post-enrollment assistance such as, health literacy, submitting documents, updating information, and also, we help with TennCare renewals. So our Health Assist program, we have healthcare access specialists who are covering that part of work too. Really, the main goal of that program is to cover those who are not eligible for any of the programs. Again, we help people with Marketplace and with TennCare, but we see a large number of people who are not eligible for either of the programs. So then our healthcare access specialists will, our health assist program, then will find resources for those who are not eligible for any of those programs, find a low-cost sliding scale fee health coverage within their community. They provide information about low-cost or free dental and vision services. They help with prescription assistance, finding, any sort of information that could help clients find either prescription drug coverage or some sort of code that they can use at the pharmacy to help them find affordable prescription. And they also help with mental health resources. So I will stop here. And then we'll let Emily give us more detailed information about TennCare. And then I'll come back and give you guys some more information on how we can share ways to connect with us and also how we can help you kind of take the burden off you. As a social worker, we understand you guys have so much responsibility, but I will be able to give you guys and ways on how to connect with us. Thank you.
You guys hear me okay?
Yes, we can, Leah.
Okay, thank you. Good morning, everyone. My name is Emily Fauché. I'm the director of our Connecting Kids to Coverage program and Health Assist programs, and I'll just be going through some basic information on eligibility for TennCare and CoverKids. So I'm just going to jump right into it. So there are 4 basic eligibility requirements for TennCare and CoverKids. The first one being state residency. You must be a resident of the state of Tennessee. You must live here. Then there is categorical eligibility, income requirements, and immigration status and citizenship requirements. I'm going to go ahead and go through the categorical eligibility and some basics on income. Leah will go more into detail on the immigration requirements. So there are a lot of TennCare categories. The most common 3 are the 3 that you guys see in the top box. Those are called the MAGI categories, which include children under the age of 19, parents and relative caregivers, and pregnant women. So these 3 categories are probably the most common. Then in the middle, we see former foster care. So this is a really important category that goes up to age 26 for anyone who has aged out of the foster care system here in Tennessee. They're eligible for TennCare up to the age of 26, regardless of their income. Then we have medically needy spend down is a great option for children up to age 21, or pregnant women who perhaps their income is a little high for TennCare. They can deduct some medical expenses in order to still qualify for TennCare. So this is great for children who have high medical needs, pregnant women whose income is too high for TennCare, or even children who we see a lot of 19 or 20-year-olds who may be independent. They don't have that much income, but they're not eligible in the child category anymore. This is an option for them to still be eligible for TennCare. Some other categories that we see here, the individuals receiving SSI are always eligible for TennCare. And then sometimes people who have lost SSI due to receiving other disability benefits could still qualify for TennCare as well. There's a couple small categories within that. Choices is really for people who need nursing home care or nursing home level of care in their homes. ECF choices is for individuals who have a developmental or intellectual disability and want supports to be able to live independently in their communities. This can be for children or for adults, but often we see this for young adults as well. And then these last 3 categories are not necessarily full TennCare coverage, but they are TennCare programs. So Medicare Savings Programs provides additional assistance for Medicare costs. Katie Beckett is a new category, or newer now, that provides a supplemental insurance to families whose children are at risk of being institutionalized because of their medical needs. And regardless of income. And then emergency Medicaid is available for, and Leah will go more into this category, but available for people who would be eligible for TennCare except for their immigration status, to be able to cover emergencies at the hospital. So it would just cover the period of the emergent episode. So those are some of the categories of TennCare super fast. I could talk about them for a week and still not give you guys all the information, but that's a kind of a brief overview. Income limits vary. For each category has its own set income limits. So that means that if you have a family where people qualify in different categories, such as children and parents, some people may qualify and some people may not, even though the household all has the same income. So that's really important to remember that income limits are different for each category. Most of the income limits are tied to the federal poverty level, but not all of them. And another really important thing to remember is it's based on the income for the month of application. So this is really important. Maybe you have a family. What we see often is families where perhaps the parents are working retail. So they work a lot of overtime in November, December around the holidays. But then come January, February, March, they have very limited hours and very limited income. So if we see that for a case of a family where they come to us in December, we might suggest to them and say, look, you're over income now, but let's wait 2 months, get your paychecks from January and February and go ahead and apply then, knowing that you could be eligible in a few months. So that is really important to remember that it is based on monthly income. This is just a quick view of the federal poverty level chart that's for the 2021 FPL levels. This TennCare is still currently using 2021 FPL levels to determine eligibility, but that usually changes around this time each year. So we do expect that to change quite soon. But again, it's a nominal change. It just goes up a little bit each year. So it's completely based on family size and on monthly income. And then this is just a visual way to represent that the different categories of TennCare have different income limits. So you can see children even within the child category, there's different levels. So a child who's a newborn, it can be eligible up to 195% of the federal poverty level for TennCare, but their sibling who is 8 years old is only eligible up to 133% of the federal poverty level. So this might be, I'm going to talk about CoverKids in a second, but this might be why you see some families where some children are on TennCare and some children are on CoverKids. And then you can see pregnant women also eligible up to 195%. And then it goes through some of the other categories. You can see former foster care, there's no limit. Transitional Medicaid, no limit as well. So there are some different limits for each category. Some important income rules to note. Especially for families where you have a non-parent caregiver, that caregiver's income never counts against the child in terms of TennCare eligibility. So unless they've legally adopted the child or they're a sibling that's under the age of 21. So a lot of times people say, oh, you know, it's a grandmother taking care of a child and the grandmother has really high income, so the child's not going to be eligible for TennCare. TennCare will ask for the grandmother's income and she'll have to even prove her income, but it won't count against the child in terms of eligibility for the child category. So that's really important to remember when people are looking at whether they could be eligible or not. Again, TennCare will ask for that income. They'll even ask for proof of that income, but people should provide that, but it won't count against them. On the flip side of that, if you're looking at, perhaps you do have a family where it's a grandmother taking care of children, for the grandmother to be eligible, her income will count for herself. So her income would have to be under the caretaker relative, the parent caretaker relative category limit, which is extremely low. That's, I think, the lowest income level category. So just a note on that, that for the caregiver, they might not be eligible due to their high income, but the child will still be eligible. And also a note on that parent caretaker relative. The definition of caretaker relative is it does have to be a relative of the child, either by marriage, blood, or adoption. But it does go out pretty far. I don't have the exact what those relations are off the top of my head. But if you needed that, that's certainly something I can get fairly quickly. So, but parents, grandparents, aunts, uncles, siblings, cousins, that sort of thing can all count as as a caretaker relative in the parent category. I already mentioned this, income doesn't count for former foster care until age 26. And then most of the MAGI categories, the more common categories, do not count resources against somebody. It doesn't matter how much money you have in the bank, how many cars you have. It's just purely based on income. But some of the disability-based categories, especially when you're looking at medically needy spend down or something like that, they will, medically needy spend down, Medicare savings programs is another big one where we see it bar a lot of people from coverage, is they do actually take into account how much money do you have in the bank, what kind of resources does your family have, in order to determine eligibility. So just be aware that if someone's getting a lot of questions about their resources, that's what's happening. They're being screened for one of those other categories of TennCare. And then just like a final note on this, TennCare eligibility is individual. So you don't get family coverage. You have, the parent could be eligible for one thing, the child another, the other child another, especially when you get families that are mixed immigration status or blended families or different family structures. You're really going to have different eligibility for each member of the family. CoverKids only has two categories, children and pregnant women. The income limit is up to 250% of the federal poverty level for both categories. So a lot simpler than TennCare. Immigration requirements for children are exactly the same as TennCare, so Leah will go through that later. And then for pregnant women, there are no immigration requirements. I saw earlier that someone asked about the new changes to the pregnant women category in TennCare, the extension to the 12 months postpartum coverage, and the extension for dental coverage for pregnant women on TennCare. And that's just been extended for TennCare at this point. It has not been extended for CoverKids. So CoverKids, the pregnant women category, is still 60 days postpartum care and no dental coverage. You can only be eligible for CoverKids if you're not eligible for TennCare, and you cannot be enrolled in any other type of insurance. So this is really important. You can have an offer of insurance through your job, but you can't be enrolled in that insurance and enrolled into CoverKids at the same time. You can be enrolled in other insurance and TennCare at the same time, but you cannot for CoverKids. This is an example of a pre-term packet. We're seeing a lot. So one thing we do with Connecting Kids to Coverage, we don't only help with the application process, but we help with all these post-enrollment assistance as well. Basically, anything we can do in order to help people enroll in coverage and stay enrolled in coverage, we're going to help them with any of that process. So I just wanted to give you guys an example of this packet because we're seeing a lot of these now. And they're really scary because you see up in bold at the beginning, it says your coverage will end soon. This is the case as was alluded to with the previous presentation with the public health emergency. the TennCare renewal process has been paused, and most people cannot lose coverage. There are some exceptions to that, but most people cannot lose coverage at this time. So people are getting these preterm packets which are about 2 to 3 pages of questions that they have to fill out and answer and send back to TennCare. They do still need to fill these out, and they do need to send them before the deadline in order to make sure. And this is just TennCare's way of making sure that they're still in the correct category and still eligible for coverage. So it is important to send these packets, but we really want people to understand that it doesn't, just because they're getting this packet doesn't necessarily mean that they're going to lose coverage or that they're losing coverage right now. Although, as a caveat to that, there are a few exceptions to that. Some people can still lose coverage, namely pregnant women on CoverKids and some children on CoverKids as well, aging out of CoverKids. So just to be aware. And sometimes they can switch within categories of TennCare. So this is a little bit of what I just said. The process for TennCare renewal will restart at the end of the public health emergency. The current public health emergency has just been extended through the 15th of July. But if it is not extended after that, then TennCare will begin their renewal process. They have a 12-month period at the end of the public health emergency to renew everybody's coverage on TennCare. So it's going to be a very busy time. We expect a lot of changes for a lot of people that are enrolled in TennCare. Previously, these renewal packets had been sent out in the mail, like 100-page packet, questions they had to fill out and send in before a certain date or risk losing their coverage. I haven't seen a copy of what that new renewal packet is going to look like, but we assume that it's going to be quite similar. I do know that they will be pre-populated with the family's information in there and asked to either update the information or confirm the information. So what people can do right now, and what's really important for them to do to prepare for this so that they don't lose their coverage accidentally or without while they're still actually eligible, is the number one thing is to make sure that their address is up to date with TennCare. So a lot of people move around a lot. It's really important that they make sure that their address is up to date because that's how TennCare gets information to them. And then making sure that they open all their mail from TennCare, read it, make sure that there's nothing that they need to do. And of course, Ida will talk a little bit more later about how you can connect them with us if they needed any assistance with their mail from TennCare or reapplying or even filling out renewal packets. That's all stuff that we can assist with. Another thing to note is those packets will be sent in batches. So there will be a group of people that's all due at the same time. And last time there was renewal, we couldn't find any rhyme or reason to exactly who was in each batch. So oftentimes we would get people calling us saying, my neighbor and my sister and my cousin all got a renewal packet that's due May 1st and I didn't get one. And it scares people. It's a little bit scary to think, why didn't I get one? What's wrong? What's wrong with my coverage? Are my kids going to lose coverage? They go out in batches like that. There's not necessarily a pattern to it, but we can also help and make sure, help people check to make sure whether they're up for renewal right now or not. So TennCare Connect is TennCare's website where people can file applications, upload documents, see the status of their coverage, see letters they were sent in the mail, complete renewal packets actually on their TennCare Connect accounts, report changes, basically anything they need to do with TennCare, they can do with these accounts. They've been really helpful to our staff in terms of if someone calls us saying, I have no idea what's going on with my coverage, we can help them create an account if they don't have one already and navigate that account to figure out a little bit of what's going on. As well as additional systems of TennCare that we have access to be able to see what's going on. So There is also a phone app for TennCare Connect that people can download and use. This has been helpful for some clients. It's been really helpful to be able to see their information. But obviously, technological literacy is a barrier. English literacy is a barrier. The website is available in Spanish as well, but no other languages. So all of this, you have to have an email to create an account. Not everyone knows how to use email or has access to it. Access to internet is another issue. So there's things that we can all assist with. But so TennCare Connect has been really helpful, but there are still some barriers there. And I know I flew through all of that. I'm sure you guys have lots of questions. I can't see the chat box right now, but I will try to respond to those questions later during the question session. If you guys have additional questions after this, please do feel free to email me or any of my coworkers, and we'll be happy to answer your questions at any point. And I'm gonna switch it over to Sharon. Who's gonna talk a little bit more about Marketplace, which is very helpful for families or individuals that are not eligible for TennCare or CoverKids.
Okay, thank you, Emily. Again, I'm Sharon Barker. Let me see if I can share. Hopefully you can see that from the beginning. Okay, I'm Sharon Barker, and as Emily said, when she has people that do not qualify for TennCare, she will refer them to the certified navigators to see if they're eligible for the Affordable Care Act. So I'm going to give you a basic overview of how that works. So what exactly is the Affordable Care Act? This is a law that provides options for consumers, including individuals, families, small businesses, their employees, to purchase private health insurance coverage through an online exchange. So in 2010, Congress enacted the Patient Protection and Affordable Care Act and the Healthcare and Education Reconciliation Act. And together, these two laws are referred to as the Affordable Care Act. And some of you may know it as Obamacare. So I like to really focus in on the features of the Affordable Care Act. There is a focus on wellness and prevention, which I love. There's financial assistance to purchase plans. One that's dear to me is the coverage for pre-existing conditions. As an asthmatic all my life, I need health insurance. And so I get it through my job, but if I didn't have a job and I needed insurance, I could not be denied because I have asthma. And then the other one that I love so much, the young adults can stay on their parents' insurance until they're 26. So like Emily was talking about, the former foster care youth can stay on theirs till they're 26. Kids who are trying to figure it out, maybe they have a little job, or they're working to get their master's and they have a part-time job. And they can stay on their parents' insurance till they're 26 years old and not have to worry about trying to figure out how they're going to get their medications or go to the hospital. A lot of the plans, or all of the plans, have the free preventive services that can be accessed. Those health screenings like mammograms, like the well woman visits, all of your immunizations and diabetes type 2 screenings, all of those are on each qualified health plan. So there are a lot of misconceptions about the ACA. They've been there since I have been enrolling people since 2013. And so we always like to make certain that when people are working with us, we dispel some of these misconceptions, and that kind of decreases the customer dissatisfaction. Like Emily was talking about, well, my neighbor got this on as a premium, and I don't know why I didn't get that same thing. It's not true that we're all going to be getting the same premium and the same financial assistance. It just depends on your household size and income. There are good plans on the marketplace. When somebody goes, well, I had it and it didn't work for me, it's probably because they didn't know how to use their insurance. And so if they work with us, we help them from coverage to care on how to get the best out of their plan. And so most Americans don't get their health coverage through the ACA. Most Americans get their health coverage through their jobs. There was a great late night host that did something on one of their shows. They walked down the streets in New York City and they asked people, would you get health insurance through the Affordable Care Act? And they say, yeah, we would do that. And they asked the same person, well, what about Obamacare? And they go, nope, we wouldn't do that. So a lot of people don't understand that they're one and the same. So when we're talking about where you're going to get this insurance that I'm talking about through the ACA, we're talking about the federally facilitated marketplace. And that's just a place where the marketplace for where all the health insurance plans are. So we're going to look at those plans on the marketplace. It is operated by the United States Department of Health and Human Services. And in the state of Tennessee, the federal government does manage all of the marketplace functions. So when you go to healthcare.gov, you'll see these screens here, and you'll know that you're on healthcare.gov and not something that sounds like healthcare.gov, like, Health Markets kind of sounds like healthcare.gov, but it's not. And so you're wanting to make certain that you're on the right on website for the federally facilitated marketplace. Who's eligible? Who's eligible to enroll in a QHP? Those people who live in the United States, they are citizens or nationals, or those non-citizens who's here lawfully for the entire time that they plan to have the coverage that they choose on the marketplace. You are not eligible for a marketplace plan if you already have insurance. You may have it through your job. You may be on Medicaid. You may be on Medicare or CHIP. You may have military insurance through TRICARE. So you're not going to be eligible to purchase a plan on the marketplace because you're already insured. Even those that are currently incarcerated, you're like, well, they don't have insurance. Well, sure they do. The state is paying for it. So they're not eligible to purchase a plan on the marketplace as well. We do use the federal poverty guidelines to determine eligibility for financial assistance. So I think Emily did show that, and we do use the same guidelines for marketplace eligibility, and especially determining whether or not you're going to get some financial assistance. The types of income that will count are those taxable incomes from your job, SSDI. I love it when I get a person that just got approved for SSDI, and they have to wait 24 months before that Medicare kicks in. So those people come to me and we are able to find them a plan on the marketplace while they're waiting for those 24 months. I have several of them. And then when that Medicare kicks in, they just drop the Affordable Care Act insurance. We have people, and you may be working with people whose children may be on TennCare, but they can't qualify for TennCare. Maybe they are a hairdresser or barber. They have a lawn company. Maybe they work a part-time job or they just self-employed. We do use that profit or loss income for determining whether or not they're eligible. Also, we don't count those workers' compensation benefits, the stimulus jobs. We will not count a minor who is getting Social Security survivors benefits. So there are some wages that don't count against the household income. There are a lot of things that go into play there. And that's why we say, hey, leave it to us, leave it to the experts. We know what income to count so that they'll get that subsidy that's correct. And we all want to lower our cost of insurance. Everybody does. Even if you have it on your job. Well, there are two ways to lower the cost of the marketplace plans. Like we were saying, a lot of misconceptions is that the marketplace is not affordable. So like Emily has those people who the children can get TennCare and the parents go, oh, I don't think I can afford the marketplace. She sends them over to me and we go through the application. The application will screen for those tax credits and those cost share reduction discounts, which are your financial assistance, and they find out that they can afford the insurance, that it is affordable because the marketplace does provide for those assistance programs. One of them being the advanced premium tax credit. And so based on the household size and income, you could qualify for that credit, and that credit is applied monthly to that monthly premium. So it's going to be sent to the insurance company on your behalf to lower your monthly premium. It's paid in advance. And those families that are between 100% and 400% of the federal poverty level limit will qualify for that subsidy to decrease their premium. Another way to lower the cost of the marketplace plan for the families that you're helping is the cost share reduction discount. So you know that money that comes out of your pocket when they go to the doctor, maybe for the co-pays or the deductibles or the out-of-pocket maximums. This is another financial assistance program that will lower those costs, those out-of-pocket costs directly applied to those. As long as that family is choosing that silver plan and they're between 100% and 250% of the federal poverty level limit, those out-of-pocket costs will be reduced. So when we're talking about picking those plans on the marketplace, I just said silver plans, we are talking about qualified health plans. So every state has to certify each qualified health plan that's going to be sold in that state. And this certification means that that plan provides a comprehensive benefits package. And that's what we call the essential health benefits. And so when you log into healthcare.gov, when it's time for open enrollment, they're going to say, hey, see the plans and see the prices for 2023. So in November, when they open it up, the insurance companies have come. We have gone down to the Tennessee Department of Commerce and Insurance. They've qualified and certified the plans that they're going to be offering. And then those plans will go on healthcare.gov. And as a certified navigator, that's what I go through to assist the families to see what they can, what plan they want to choose. When I talked about those 10 essential health benefits on every qualified health plan, these are what I'm talking about. All of them will have to have some pediatric services, prescription drug services, maternity and newborn, emergency, hospitalization, and of course, those mental health and substance use disorder services, including behavioral health treatment, is huge because we know, as Kylie was talking about, how the decline in mental health is being prevalent right now in the community. So these are the 10 essential health benefits that every qualified health plan will cover. So what insurance companies offer a qualified health plan on the marketplace in Tennessee? These are the 6 that the people can choose from: Cigna, Ambetter of Tennessee, Bright Health, Oscar, United Healthcare, and Blue Cross and Blue Shield. So I think there are probably over 90 plans between the 6 of these that people can choose from in their different regions. It might be different plans offered, of course, but that's why we have certified navigators across the state of Tennessee that can help figure out what you can enroll in. So every year, November 1st through January the 15th is open enrollment. But sometimes, like now, it's April. You go, well, what happens to me? Well, what happens to you is if you're experiencing a certain qualifying life event, then we could possibly enroll you in a health plan under what's called a special enrollment period, or SEP. So within 60 days of that qualifying event, you come and you say, hey, I need health insurance because maybe I just moved to Tennessee, or I lost my job. I had insurance and now I don't. Or I, just became a widow, or I just got married. What about that 26-year-old that just aged out of their parents' insurance and now they're going, what am I going to do? Because I do have medical bills. I do have things that I need covered. Or maybe you left the Medicaid category. So these are all life-changing moments that if you're experiencing those within 60 days of that qualifying life event, you can come talk to a navigator or go on to healthcare.gov and apply for insurance under a special enrollment period. There is a new one called the low income SEP. And this is for people who are eligible for a tax credit and they have projected income between 100% and 150% of the federal poverty level limit. So this new special enrollment period is on the federal marketplace, and it will allow those low income people to enroll in a plan in any month during the year. So you don't have to have one of those qualifying life events to unlock the door for this SEP. And so that one's a good one for those people that you are working with that are low income. The SEP for recently released from incarceration, I think this one is very important. Like in Davidson County, we have a zip code, 37208. It is the highest incarcerated zip code in the country. So we have a lot of people that are released serving terms in jail or prison, and they may come out and need insurance. So again, within 60 days of that release, they can qualify for what's called recently released from incarceration, SEP. Now, those people probably would have been eligible for Medicaid, but Tennessee did not expand Medicaid, so that they come out of prison, jail, they're under the 100% of the federal poverty level limit because they don't have a job yet. And so they can't get the tax credits, and then they may not be in a category for Medicaid. So because we didn't expand, that's going to leave those people in the gap. And that means they're not able to qualify for either the insurance under the marketplace or the Medicaid category. And that's what it looks like. You have Medicaid on one side, you have marketplace subsidies on the other side. And in the middle, if you don't qualify for either one of those, you're in the gap and you don't qualify for anything. And we will refer you to our Health Assist or Safety Net programs to help you. So what I love about this SEP, leaving the Medicaid gap, is because those people that live in a state that did not expand Medicaid, and they were not eligible for the tax credits solely because they were below the federal poverty level limit, and they also live in a state that didn't expand Medicaid. Once, say for instance, they get out and they get into a program that's helping the release from incarcerated individuals find a job. And maybe that job does not offer insurance, but it does offer enough money to make them eligible to qualify for tax credits and subsidies. Now they can come back into the marketplace because they have left the Medicaid gap. Maybe they're not incarcerated, but maybe they just are a low-income person that found a job that put them above the federal poverty level limit. Or maybe they got married and there's two people that were low income at first and they couldn't qualify for tax credits and they couldn't qualify for Medicaid because they didn't fit a category, but they got married. And now that combined income puts them above the poverty level limit for two people. So now they're eligible to leave the Medicaid gap, call a certified navigator, and get an SEP and get health insurance. So, how can we help you? A lot of times, like your clients fall into that TennCare gap. But like Emily said, some families have some people that qualify for TennCare and then the parents don't, or it's just that mixed situation. So when that happens, if you're a teacher and counselor and social workers, caseworkers, healthcare workers, we need you to refer those uninsured kids and families to us. It takes that work off your plate and lets us help those people by phone, virtually, in person. Ida said before, we do it in a culturally competent manner, and all of our services are free and unbiased. I put all of that in there really quickly. It's a lot more to the ACA, but we do want to make certain that you get a basic overview. And of course, that's my email. If you have any clients that don't fit into the TennCare category, that's what our Navigator program does. And you can just refer them to us and we can do that work for you. So I'm going to turn it over to Leah, and she is going to talk more about immigration.
Good morning, everybody. I am Leah James. I'm the lead healthcare navigator with Family and Children's Service Get Coverage Tennessee program. And as Sharon said, I'm going to be sharing with y'all about qualifying for insurance as an immigrant. So there's going to be some review of what some other people have gone over here, but just to kind of clarify it in terms of being an immigrant and how things might change based on specific immigration status. So this is kind of an overview of what we're going to cover. I'm going to review those insurance programs that my team already went over. I'm also going to touch a little bit on refugee medical assistance and mixed immigration status families. So programs that are available to immigrants in Tennessee include refugee medical assistance. It's available for 12 months to newly arrived refugees who do not qualify for Medicaid or CoverKids. TennCare, which is of course our state's Medicaid program, applicants must meet different criteria, which is both a categorical and income-based criteria to qualify, which of course Emily gave us a good overview of. And then CoverKids, which is our state's children's health insurance program, which is available to children and some pregnant women. And then the marketplace insurance programs, which of course Sharon just gave you a great overview of. So refugee medical assistance is available, as I said, to people who have been afforded refugee status or other qualifying status, which could include, I believe, asylee status as well. You have to be approved for asylee status. You cannot have a pending approval. It is based on your status, your income, and also you have to be ineligible for other state programs like Medicaid and children's health insurance programs, because refugees and asylees can be automatically approved for Medicaid and CHIP if they meet the categorical requirements. Refugee medical assistance benefits have actually been extended. They previously lasted for 8 months, and just within the last few weeks, I believe, they have been extended to 12 months. And those RMA benefits do automatically terminate after the 12-month period. Now, to clarify, we at Family and Children's Service do not help people apply for refugee medical assistance. That is something that the refugee individual or families will have help qualifying or applying for when they are connected to refugee assistance programs as they're entering the country. But we just want you to be aware that this is an option if you're working with refugee families, that they, if they're not already enrolled in RMA, they should get enrolled in that, because it is a great benefit that works very similarly to regular health insurance. It covers your major medical services, hospitalization, doctor's visits, medication, all the basic services you expect to be covered through health insurance. And that special enrollment period that, or the special enrollment periods that Sharon reviewed, loss of refugee medical assistance actually triggers a special enrollment period. So if you're serving a refugee family who is going off of their RMA benefits, we can actually help them enroll in marketplace coverage if they do not have access to insurance through an employer or another means of coverage. TennCare, which of course Emily went over in detail, gets a little bit more complicated when you are an immigrant. So there are 2 categories of immigrants, qualified and not qualified. So obviously a qualified immigrant, if they meet the categorical and income requirements for TennCare, will qualify to enroll and access TennCare benefits. A non-qualified immigrant will be denied TennCare because they do not meet the immigrant qualifications. And at that time, we would screen them for other services like refugee medical assistance to make sure they, don't qualify for that. And of course, marketplace coverage, which we'll go into in more detail in a few minutes. So qualified immigrants can be eligible for TennCare after holding a qualified status for 5 years. We refer to this as the 5-year bar. So even if you're a low-income family with children, low-income children, if you have not had your green card or another status for 5 years, you do not meet what we call the 5-year bar. So you have to be a lawful permanent resident or a green card holder for 5 years, granted parole for at least 1 year, or a battered spouse, parent, or child. Some people with humanitarian status are exempt from the 5-year waiting period, as I mentioned previously. So refugees, asylees, Cuban Haitian entrants, Iraqi or Afghan special immigration status and recent Afghan entrants, Amerasian immigrants, military veterans, those holding T visas, or lawfully permanent residents who previously had another of these statuses. So There are some exceptions to the rules where you will go ahead and be approved for TennCare, assuming that you once again meet those categorical and income requirements. So low-income children, low-income parent caretakers of minor children, and some of those other statuses that Emily referred to in her program. CoverKids and immigration status is going to be a little bit different from TennCare and immigration status because CoverKids extends pregnancy coverage to women who are not legally present and pregnant women who do not meet the 5-year bar. So it's really important for women who are not legally present to understand their access to CoverKids. You don't have to have a social security number. You don't have to have any sort of documentation. If you are pregnant and a resident of Tennessee, you can apply for CoverKids. And what that's effectively doing is they're covering the child who will be born in the United States with the expectation that that child born into the United States will be a citizen. Unfortunately, that extended pregnancy postpartum coverage, as Emily mentioned, has not been extended to the CoverKids enrollees. They still only have 60-day postpartum coverage. But the children born to the CoverKids enrollees are automatically enrolled into CoverKids for a year. It should be done through the hospital. So not only does the woman being enrolled in CoverKids, as we all know, help with a safe pregnancy, a safe delivery, safe mama, and safe baby, it also ensures that that child should be automatically enrolled into CoverKids through the hospital at the time of birth. And the CoverKids application process can be really complicated and daunting and scary, especially for women who are not legally present. So that's something that Emily and her Connecting Kids to Coverage staff specialize in, is connecting with those women and those families to make sure they understand that they do qualify for these programs. And it does not put them into harm's way as far as ICE or immigration authorities are concerned. They cannot be, targeted for enrolling in these programs. So we try to be really understanding and culturally sensitive to these families as we help them enroll in these programs. And our marketplace staff is also trained in how to enroll folks into this coverage as well. So it's the same income limits for the pregnant women who are not legally present or don't meet the 5-year bar, as Emily referred to previously. So you can be up to 250% of federal poverty level. We do look at this as a household size. And so the pregnant woman's household size includes her and the amount of babies that are expected. So if it's twins, her household size would be 3. If it's one baby, her household size would be 2. If we're just looking at her just as a pregnant woman, the rest of her family is overseas still or whatever, or she's alone in the country with just herself and her pregnancy. The immigration requirements for CoverKids are generally the same, once again, except for the pregnant women. So unfortunately, other individuals who are not legally present cannot qualify for CoverKids. It's just the pregnant women that can qualify for CoverKids. One exception to the rule is if someone is in the U.S. on a tourist or visitor visa, they cannot access CoverKids. When you apply for a tourist or visitor visa, you're actually signing a statement saying that you are capable of covering all of your medical costs in the case of a medical emergency. So you cannot come over on a tourist or visitor visa with the sole purpose of giving birth in the country and get benefits. Another thing to be, to understand is that if you're here as a tourist or a visitor, you can't really be a resident of the state of Tennessee anyways, and you do have to be a resident of the state to qualify for CoverKids. As Emily mentioned, you cannot have any other type of insurance to qualify for CoverKids, but you can be offered coverage that you're not enrolled in. You just have to waive that coverage or terminate that coverage in order to qualify for CoverKids. Obviously, for women who are not legally present, that's not going to be really a concern. Perhaps women who have not met the 5-year bar, perhaps they'll have a spouse or family member who has access to coverage through an employer. And if that's the case, they would have to either terminate or waive that coverage to qualify for CoverKids during their pregnancy. And once again, the CoverKids coverage only covers 60 days of postpartum care for the pregnant women. So Emily also mentioned emergency Medicaid. So these are some temporary coverage options available for immigrants. Emergency Medicaid is available for an emergency sudden onset hospital visit and the duration of the hospital stay if admitted. So this is a very temporary coverage. The application process typically occurs in the hospital. It's only available to those who are not legally present or who do not meet the 5-year bar for TennCare and CoverKids. So you can be legally present and in that 5-year waiting period. If you have an emergent situation and present at an emergency room, the emergency room staff can apply for emergency Medicaid to cover the duration of your visit. You must also be otherwise eligible for Medicaid. So in other words, you must be categorically an income eligible, but you don't have to have a Medicaid denial, but be ineligible for Medicaid based on your immigration status. There are some cases where emergency Medicaid applications can be backdated. So if someone had an emergency room visit, the hospital did not apply for that coverage, and they need assistance with those medical bills, our staff can help with an application for it and a backdating to request coverage for that hospital visit. But that is pretty complicated. So the hope and the expectation is that this application process should be completed in the hospital by staff at the hospital that are specifically there to help with this process. But unfortunately, that's not always the case. So if you encounter clients or families who are reporting to you that they had an emergency room visit and are receiving massive medical bills, as we know occurs from emergency room visits, if they are not legally present or do not meet the 5-year bar, you can refer them to us and we can go through the process with them to try to get emergency Medicaid approved and backdated. That does require quite a bit of documentation. Just to let you know, there's gonna be documentation of the medical visit, of the reason for the visit, and all that. So it's good that we are able to help you process that, because it's a lot of paperwork, especially for somebody who doesn't have English proficiency or does not speak English at all. It can be really complicated to go through that process. The other temporary coverage for immigrants is something called a reasonable opportunity period. And I had mentioned at the beginning when she was introducing us that we help with the whole process of enrollment. So from start to finish of enrollment, we help you and your clients create accounts to do an application, do follow-ups, provide documentation that may be requested. Both TennCare and Marketplace can require follow-up documentation to approve or continue coverage for individuals. And for those that don't have English proficiency, don't speak English at all, aren't technologically literate. We know there's also just some basic lack of literacy in the country in general and our state in general, even if you are a native English speaker. People who lack those literacy levels can really struggle to complete the follow-up processes that are required to remain approved for these programs. And so that's something that our staff does for all of our clients, is follows it through from start to finish. So the reason I'm mentioning that is that this reasonable opportunity period is a 90-day period where applicants are granted TennCare coverage while TennCare attempts to verify their immigration status. So immigrants specifically can find themselves having to provide a lot of documentation to show that they're legally present, for TennCare to show that they meet the immigration status requirements. What will happen after an application is completed is you will get a letter asking for proof of immigration status, and the documentation must be provided within a 90-day period for this reasonable opportunity period. TennCare generally gives you 20 days to provide documentation before approval or denial of an application, but they are required to extend that to 90 days while they try to verify an immigration status. So someone can get a reasonable opportunity period approval. They'll get a letter saying that they've been temporarily approved for this 90-day period, but the documentation to verify their immigration status is required. And once that's provided through the TennCare Connect portal, which we help the clients create, or by faxing directly to TennCare, which we can do for the client, eligibility will be reassessed based on the documentation provided. If the documentation has not been provided by the 90th day, you are in danger of losing your coverage. So especially for pregnant women, this is really important. If you apply at the beginning of your pregnancy, obviously at the 90th day, you are not done with your pregnancy and you need to continue accessing medical care. So it's really important that proper documentation is provided for these applications. Unrelated to immigration status, documentation of income is another thing that can be required. Sometimes they even require like proof of relationship to individuals, where you have to provide like a birth certificate showing that you're somebody's parent, or, you know, all sorts of various stuff. The 90-day reasonable opportunity period only relates to verifying the immigration status, though. My point is that it's complicated, and that's what we're here to help with, is just walking you through the whole process. So Sharon mentioned the Medicaid gap. I'm going to go back to the Medicaid gap a little bit more in depth when I talk about the marketplace. So I just want to kind of explain to you once again what it is. People fall into the Medicaid gap in Tennessee because Tennessee is one of, I think it's about 12 states at this point in time that have not expanded their Medicaid coverage to cover all low-income individuals in their state. So if your income is too low to qualify for that marketplace financial assistance that Sharon mentioned, and you don't meet a qualification for a TennCare category, then you fall into the Medicaid gap. You can go buy insurance through the health insurance marketplace if you're in the Medicaid gap, but you're not going to qualify for financial assistance. For a 45-year-old person to get insurance through the marketplace without the financial assistance, you're talking about maybe $350 to $450 a month for a very bare bones, high deductible plan. So although they're allowed to enroll in coverage, it's just so unreasonably unaffordable that it's not possible. In Tennessee, we have about 280,000 people who need care but can't get it because they are in the gap. But for immigrants barred from TennCare due to the 5-year bar, the Medicaid gap is waived. So this is a very special instance where someone can be too low income to qualify for financial assistance through the health insurance marketplace, but they are being barred from TennCare because their immigration status does not meet the rules. And they can actually apply for financial assistance through the health insurance marketplace, get full financial assistance, and currently access $0 monthly premiums for silver marketplace plans with $0 copays for doctor's visits. So this is a really important thing for immigrants to understand, is that if they, you know, have a neighbor who's on TennCare because they've met the 5-year bar or have become citizens, and they go try to apply for TennCare and are denied, that doesn't mean they can't get insurance. It just means they need to take a different avenue to get it. And it's, once again, can be a complicated avenue. So we help them follow that process to get enrolled in the coverage that they qualify for. For those non-immigrants that fall into the Medicaid gap, Family and Children's Service does offer a program called Health Assist, where we refer individuals in the Medicaid gap to get help with enrollment in prescription assistance coverage, access to reduced price clinics in their region, or financial assistance from the hospitals that serve their region. And we take them through that whole process. So we really are like a full service location across the state to serve people who need access to health insurance. So everyone's been referring to the federal poverty level chart. This is the 2021 federal poverty level chart, which TennCare is still using. As Emily mentioned, they'll transition to 2022 federal poverty level sometime in the coming weeks or months. Marketplace will continue 2021 federal poverty level chart until next open enrollment period for 2023 coverage, which starts in November. So that's just another layer of confusion for eligibility, right? And that's another reason why it's great to just refer people out to us, because we can navigate which federal poverty level chart we're looking at and all of that good stuff. This is just a review of the immigrant eligibility and who can qualify for what programs. So for TennCare, as you see in the first column, you have to have a green card or be a parolee for 5 years or more. Refugees, asylees, members of the U.S. military, trafficking victims, or people who entered under one of these statuses and now have a different status. Those are the only ways to qualify for TennCare. For CoverKids, you can qualify if you're pregnant, no matter what your status is. If you have a green card, you can qualify for CoverKids if you've had it for at least 5 years. For non-pregnant women, if you have a green card and have had it for at least 5 years, you can qualify. And then refugees, asylees, et cetera, can qualify for CoverKids as well. So children who are too high income for TennCare can transition onto CoverKids if the family's making more money than they did when they first arrived at the country. And then if you're undocumented and pregnant, you can qualify for CoverKids. Marketplace, all scenarios. If you have a green card for less than 5 years, you qualify. If you've had a green card for more than 5 years but don't qualify for TennCare or CoverKids, you can get Marketplace. If you're a refugee, an asylee, etc., you can get Marketplace. If you have a temporary status, you can get Marketplace. You cannot get Marketplace if you're undocumented. That is the one situation where you cannot get Marketplace. And then emergency Medicaid, you can access if you're undocumented, or if you have had a green card for less than 5 years and have not been fortunate enough to sign up for Marketplace coverage. All right, so for Marketplace insurance, who can enroll? Families and individuals who do not meet the 5-year bar for TennCare, as we've discussed. Families and individuals who are exiting off of refugee medical assistance would qualify for a special enrollment period for Marketplace. Families and individuals who are not categorically or income eligible for TennCare or CoverKids, or who are losing eligibility for TennCare and CoverKids. So this is going to be important when that redetermination process starts after the public health emergency ends, which is coming up in the next couple of months, we expect. Once they begin the redetermination process, if they discover that you are no longer eligible and they kick you off TennCare or CoverKids, we can then screen for Marketplace financial assistance. You have a 60-day window to access the special enrollment period. So loss of any of this coverage that I'm talking about, the refugee medical assistance, loss of TennCare or CoverKids, 60 days from the date that you lose that coverage, we can screen you to see if you qualify for Marketplace financial assistance and help you access enrollment into the Marketplace. If you're given a heads up that, we know refugee medical assistance ends at the 12th month, we can help you 60 days in advance. So we can start helping families in the 10th month of their refugee medical assistance to look into Marketplace options and have it set up for a smooth transition where the refugee medical assistance ends on the 31st of a month, and on the 1st of the following month, the Marketplace insurance starts. Same for TennCare and CoverKids. Once the redetermination process is completed, they should receive a letter saying this is going to be the last date of your coverage. I say should because we all know that sometimes communication gets lost in the mail or is, otherwise not received. So as long as someone is reading their mail and getting their mail, if they know the last date of coverage for TennCare is going to be August 28th, they can come meet with us up to 60 days in advance of that loss of coverage, and we can start the process for Marketplace insurance screening and enrollment to try to have coverage that starts on the date that they lose their coverage from TennCare or CoverKids. Another really important category of who qualifies for Marketplace insurance is individuals over 65 who do not qualify for premium-free Medicare Part A. I bring this up because if you have immigrant families who have brought over elderly parents once they've settled and they apply for a green card for their parents, have their parents come over. If you are over the age of 65 and you've not lived in the United States and paid into Social Security, you have to pay at least 40 quarters into Social Security to qualify for a premium-free Medicare Part A. And then there's this whole other process to get Medicare Part B, supplemental plans, Medigap, Medicare Advantage plans. There's this whole process. If you are a newly arrived eligible immigrant who has a green card and you have not paid into Social Security, you are not going to qualify for premium-free Medicare Part A. And a lot of times people are bringing over their elderly parents because they're elderly and they're becoming unwell as they get older, and they're bringing them here to access insurance and medical services. But without Medicare, that can be really hard to do. So we help people screen their parents, their elderly parents, for financial assistance through the health insurance marketplace. Now, you do have to be above 100% of federal poverty level to qualify for that financial assistance. So if mom and dad are able to work, they can qualify based on that income. Of course, if they're elderly and in poor health, it's likely that they perhaps will not be able to work. So if an individual or family is able to claim that person, that mom, that dad, both of them on their income taxes, if their household income and household size puts them above 100% of federal poverty level for that household size, including mom and dad, or just mom or just dad, they can qualify for financial assistance through the marketplace to enroll their elderly parent on marketplace coverage. Even if they work for, say, FedEx or some other large company and they're offered insurance for themselves and their children, that offer of coverage is not going to be extended to the elderly parent. So there's some creative ways that we can help these elderly individuals access health insurance if they're newly arrived immigrants who are legally present. And that leads me to the final point, is that you must be legally present to qualify for marketplace insurance and financial assistance. Sharon already went over the advanced premium tax credits, which is that financial assistance that's built in and based on tax filing household size. There's also those cost sharing reductions, which reduce your out-of-pocket expenses for doctor's visits, et cetera. In normal circumstances, the income requirements for these advanced premium tax credits and cost sharing reductions are that you must be above 100% of federal poverty level. And of course, the further away from 100% of federal poverty level you get based on your household size, the less financial assistance you get. The one, my words just stopped. The one exception to the rule is if you are an immigrant who is being barred from TennCare enrollment due to the 5-year bar, the 100% federal poverty level requirement is waived for you. So families that are newly arrived at the country that don't meet the 5-year bar can get full financial assistance through the health insurance marketplace, even if they're not working. They can be zero income in the household, but because they are being denied TennCare based on their immigration status, they are given full access to full financial assistance through the health insurance marketplace. And as I said, that can mean access to a $0 a month premium with a $0 copay for doctor's visits, and in some instances, as low as an $800 out-of-pocket maximum for services like hospital visits, et cetera. It can be really hard, especially if they have neighbors or friends who are TennCare eligible. It can be really hard for them to understand why they can't get TennCare. And so it's really hard for them to go through the process and see that there are options out there that are available to them until they've hit that 5-year bar. And then of course we help them transition at the 5-year bar date onto TennCare. And the 5-year bar is to the date. It can't be, I got my green card in December of 2020. So in January of 2025, I should be eligible for TennCare. No, it's going to be December of 2025 to the date that you qualify. So we help these families get marketplace insurance coverage until they qualify for TennCare. And as soon as they qualify for TennCare, we can help them transition on to TennCare. So marketplace insurance for immigrants, these are the eligible immigration statuses. There are probably some missing. As you can see, it's a pretty exhaustive list. Obviously, lawful permanent residents, asylees, refugees, Cuban Haitian entrants, those that are paroled into the US, those granted conditional entrance before 1980, battered spouses, children, or parents, victims of trafficking. It's a really long list. So the best thing to do is if you have someone who's an immigrant and you're unsure if they're eligible, just send them to us and we'll screen them for all the programs to make sure that they qualify, and then make sure they provide the correct documentation showing that they qualify.
Sorry.
Go ahead. Yeah.
We're going, I think, a little over time, but.
Oh, do I need to stop?
Okay. No, I mean, if you finish, I can just show our last slide, and I'm not sure.
Do you want me to stop sharing?
No, you can continue. I'll
Okay.
just
Okay.
update.
We're almost done. So for families that have mixed immigration status, it can be really common for people to qualify for different programs. We kind of referred to this already. So it can be true for immigrant and non-immigrant. They can qualify, you can have people qualifying for TennCare and Marketplace. But it can be even, I think, more complicated for people that don't speak English very well or don't have the technological literacy to navigate the program. So we make sure to let people know that it's okay to be enrolled in different programs, but it can make the application process more confusing. So once again, just reach out to your clients, refer them to us. If you feel like it's a complex situation, we're happy to help. And one thing that we really try to make clear to mixed immigration status families is that applications cannot ask for the immigration status of individuals who are not seeking coverage. So this is important when you have a mom or a dad or both who are not legally present, but children who are legally present. It helps protect the family members who are not legally present while still providing access to insurance for those who do qualify. And this is just a review of when you can apply. And once again, it is okay to apply for children or other family members, even if you do not have legally present status. Thank you so much, guys. Sorry to go over.
Thank you, Leah. Susan, are we over time? I just have one slide to share. Where we can send them.
Go ahead and share your slide if you want to, Ada.
Okay. So real quickly, I don't know if you see the page. All I want to iterate is that we, obviously are here to help you in any way, shape, and form with your client, with your own healthcare needs. Again, you're busy, you have other responsibility as a caseworker, so we want to take that load off of you. And as Kylie mentioned in her data, there's a lot of people who need our help, who are not well informed about services that are available for them. So we can do that for you guys. You can give your client our phone number, as you see here. You can schedule appointment for in-person or over the phone appointment by going to our website. We also have a referral form on our website that you can use to send your client, so we can make the initial call for the client to the client. Or if they know what time and date that they want to be contacted, the website will guide you on how to schedule an appointment for in-person or over the phone schedules. We are more than happy to send you flyers if you want to share it to your clients and then just pass out that information. If you are doing any outreach event, or if you know of any event, we'll be more than happy to join you and share our information. And if you are wanting to partner with us and have us serve your clients continuously, we are more than welcome to do so. So you can reach out to us. This is our information, mine, Emily, Sharon, and Leah. We are well staffed and we have enough people to serve, I would say, the whole state. So please, whenever you think of health insurance, think of Family and Children Service Get Covered Tennessee program. Thank you all so much.
Thank you all very much. We appreciate you. And Jerry?
A lot of good information, and I hope y'all have stayed with us for a while. Next up, we did not want to exclude the mental health piece because we know mental health access is just as important as physical health and they affect each other. So we have asked Katie Lee to join us today so that she can talk to us about mental health access. Katie Lee is the Director of Behavioral Health Safety Net and Older Adults at the Tennessee Department of Mental Health and Substance Abuse Services. Katie is a licensed master social worker who received her Bachelor of Science in Social Work from the University of Tennessee at Martin and her Master's of Science in Social Work from the University of Tennessee. She has worked with several programs within the Tennessee state government, including Employment and Community First Choices, Individual Placement and Supported Employment, and Peer Wellness programs. Before coming to the department, Katie worked in community mental health setting as a therapist and case manager, so she's an expert on all of this. Raised in Middle Tennessee, Katie lives in Hendersonville with her husband and 2 children. So we welcome Katie, and she's going to let us inform us all about the mental health piece of this.
Thank you so much, Jerry. I appreciate the opportunity to share about Behavioral Health Safety Net and share about programs within the Department of Mental Health. So I have a slide deck here. I will share it and with you guys so that you guys can email out to all the participants. And so the Behavioral Health Safety Net, I first wanted to share with you guys about the Tennessee Department of Mental Health and Substance Abuse Services, our mission and vision. So we are a state government agency, and we create collaborative pathways to resiliency, recovery, and independence for Tennesseans living with mental illness and substance use disorders. And our vision is to be a state of resiliency, recovery, and independence in which Tennesseans living with mental illness and substance use disorders thrive. And so aligning with our mission and vision of our department is a program called Behavioral Health Safety Net. There's a Behavioral Health Safety Net for adults and a Behavioral Health Safety Net for children, and I'll walk through both of them today. So first, we'll start with the Behavioral Health Safety Net for adults. It's operated through the Department of Mental Health. And if there's anything you're going to walk away with today about the Behavioral Health Safety Net is that it provides outpatient mental health services to uninsured Tennesseans who meet the program eligibility through a network of 15 community mental health agencies across the state. The Department of Mental Health, outside our regional mental health institutes, we do not provide direct clinical services. We contract with community mental health providers across the state, and there are 15 providers. I have a slide that will show the 15 providers that provide the actual behavioral health safety net direct services. Just a little history about the behavioral health safety net. Back in 2005, back during the Bredesen era in 2005, there was a mass disenrollment from TennCare. And in response to that mass disenrollment, there was money set aside to create the mental health safety net that provided services to individuals with severe mental illness that had been disenrolled. And then in 2009, the mental health safety net merged with this state-only program that was operated through TennCare to create what we have now, the behavioral health safety net. So as it is now, it's been around since 2009, 2005-ish. So the criteria to be in the behavioral health safety net is that they've been determined to be ineligible for TennCare. So TennCare has flat out said you're not eligible, or they've completed a TennCare application and they're waiting for determination. Another eligibility criteria is that they do not have private insurance, or they don't have private insurance that pays for behavioral health, mental health services, or that they possibly have exhausted all their mental health services under their plan, that they don't have behavioral health benefits through the Veterans Administration. To be eligible for the safety net, you must be a U.S. citizen or a qualified alien, and you must be a resident of Tennessee. For the behavioral health safety net, we do not have a length of residency to prove residency in Tennessee. If you were living in Arkansas and you moved in with a family member in Memphis, we consider you that day a Tennessee resident. Additional eligibility criteria is to be diagnosed with a qualifying primary mental health diagnosis. So to be in the safety net, outpatient mental health services, you must have a mental health diagnosis. We have a pretty exhaustive eligibility list. It's several pages long. So almost every mental health diagnosis is covered under there. Another eligibility criteria, I see that there are questions, but they pop up so quick the way I'm sharing my screen, I can't see them. So maybe at the end I can catch them really quick. Another eligibility criteria is to have a household income at or below 138% of the federal poverty level. I know that's been discussed a couple times today, but for a family of one, it's right under somewhere around 18,000. For a family of four, it's about 34,000 a year. The adult safety net is for 18 years and older. And then finally, to be eligible for the safety net, not be in an inpatient facility or nursing home, or to be an inmate or incarcerated. So on this slide here, you can see the services that are available for safety net for adults. As you can see, they are pretty your standard outpatient mental health services. So the biggest services that we have going out the door are individual therapy, psychiatric medication management, and case management. Now, you can see there's other services offered there, but those are the three big ones that are going out the door. So the behavioral health safety net for children was, we received additional dollars from the governor and the state legislature for FY21 to begin the behavioral health safety net for children. It officially launched off the ground in September 2020, so this is still a pretty young program.
How are you? That's okay.
I think someone is not muted, maybe. There you go. Okay. And so the Children's Safety Net also provides essential outpatient mental health services for uninsured and underinsured. We'll talk a little bit more about that here in a second. Children ages 3 to 17 who meet program eligibility through, they're also served through our 15 community mental health centers. The Behavioral Health Safety Net helps connect or refer the uninsured children to other behavioral health services such as TennCare, CoverKids, and each provider agency has an outreach coordinator who can assist families. And I'll share a little bit more about that here in a moment. So to be eligible for the safety net is that you don't have any behavioral health coverage. So a child is uninsured, or they have maybe an insurance that does not have behavioral health benefits. So they don't have a payer for behavioral health. But we also have two additional categories for the behavioral health safety net for children. Children with CoverKids and children with private insurance may also enroll in behavioral health safety net for children to receive a limited service array. I'll show that list here in a second, but children that are on CoverKids and private insurance, that there are some services, outpatient mental health services that CoverKids and commercial insurance does not cover, and they can enroll in behavioral health safety net to receive those services that aren't covered through those other insurances they may have. The safety net for children, you must also have a qualifying mental health diagnosis. It's for ages 3 to 17. A lot of the same eligibility categories: U.S. citizen or qualified alien, resident of Tennessee, and not in a long-term facility or in state legal custody. And then another thing that is different about the safety net for children is, regardless of income, all children are eligible if they meet all the other eligibility criteria. We do not have an income cap for safety net for children. We do have an income eligibility for adults, but for children, regardless of your income. So what you see here is the services for children. The ones with the red asterisks are the ones that are, if you've been enrolled and you have CoverKids or commercial insurance, those are the services that are available to you. The two biggest ones we see going out the door for children with CoverKids and children with commercial insurance is case management and family therapy are the most utilized services. So the safety net for both adults and children does not cover prescriptions, but what we know about mental health treatment and recovery is that for many people, medication is part of that recovery journey. So lots of people in safety net, they see their psychiatrist or their psychiatric nurse practitioner, and they are given a prescription. And so while we don't pay for prescriptions, we do help providers, our safety net providers, be able to have pharmacy assistance and coordination, where they help the safety net enrollee either secure medication through some sort of pharmacy assistance program or through coupons, or help them enroll in CoverRx. CoverRx is operated through our sister agency at TennCare. It's for people 18 to 64, and it's designed to help them, people who do not have pharmacy coverage but need a medication. When they enroll in CoverRx, there are low copays for the prescriptions. Some of them are $3, some of them are $13, but to help them get their prescriptions at a hopefully more affordable price. So what you see here is a map of our provider network. At the bottom, you can see in each one of the regions our safety net providers. So if you're familiar with community mental health, you can see that these providers are very robust community mental health providers. They all have more than one physical site. They all have contracts with all 3 of the MCOs. Almost all of them are members of the our statewide organization for mental health organizations, TAMHO. So these are large players in the community mental health field. When you look at the map, so this is the adult map, you'll see that some of these counties are highlighted brighter blue. Those are counties that we have a physical outpatient location in those sites for behavioral health safety net. The shaded ones are where there's not a physical location. Before March 2020, we kind of hung a lot on where the physical locations are. What we have found, almost as everybody has found since the pandemic began, is that telehealth and telephonic services have greatly been able to increase our access, especially in these areas where you see, like in West Tennessee along the Tennessee River, there's several counties in a row that don't have a physical site. In the upper Cumberland area, there's some counties that don't have physical sites. And so telehealth and telephonic have really just exploded with behavioral health safety net, but there still are physical sites across the state. And then this is the map for the children's. There's a couple more counties that don't have a physical site for children's services, but all the dark green is where you're seeing that there's a physical site for children, and it's the same 15 providers. I do want to speak about the outreach coordinators. So each one of the providers doing the children's safety net, they have at least one outreach coordinator, and their focus is to get the word out about safety net for children. So that families that maybe they're not getting mental health services because they believe they can't afford it, or they're not aware of all the different programs, they aren't just going to show up at the community mental health center and say, what do you have available for our child? And so we really want the outreach coordinators to get the word out in every capacity at pediatricians' offices. We want county health departments, subsidized housing. We want every turnover, every rock to make sure that the community is aware that there is this service. The outreach coordinators also work with our schools and the department's funded school-based behavioral health liaisons as they're identifying children in the school system that maybe additional mental health support would be needed. The outreach coordinators can connect them. And then the outreach coordinators also assist families with enrollment and intake at Behavioral Health Safety Net for Children. For a lot of these children and their families, it might be their first time to engage in mental health services. We've have stories of outreach coordinators meeting the family in the parking lot and walking in with them because it's the family's first time to even walk into that building. And so these outreach coordinators are helping to fully connect the dots to get the family connected to mental health services. So maybe you're listening and you're like, oh, this is great. How can we connect somebody? So one thing is when you're talking to people about the behavioral health safety net, to let them know that it's these core mental health services to uninsured Tennesseans or uninsured, underinsured Tennessee children. And there's providers across the state. It doesn't matter what county you live in, it's available. And then you can help them identify a provider in their area by using our one-pagers that I'll make sure are sent out with these slides, or going to our website. Our website has an interactive map where you can click on the county. So if you live in Weakley County, you can press Weakley County and you can find out what providers have a physical site there or in a county neighboring. And then you can assist them with the contact info. You would call that provider, let them know, I think I'm eligible for safety net. Oh, this says safety net for children. This is also true but for adults too. But that you call them and you just let them know, I think I'm eligible for safety net. And the provider will run with the ball then, get you an intake appointment and screen that person for safety net. For Safety Net for Children, our outreach coordinators' contact information is also on our website. There's an interactive county map where you click on the county and it tells you the outreach coordinator for that county. The provider will assist with determining their eligibility, enrolling them. There is some proof that they eventually do have to get, like proof of income for adult safety net, but the provider will work with them and get all that information for them. And then the provider will also assist them in getting any kind of prescription assistance they need if they are being prescribed any kind of mental health meds. So some facts just to keep in mind, it's outpatient mental health services only, not inpatient or intensive outpatient services. We have 15 community mental health providers for adults and children across the state. There's 146 locations in 71 counties, with 54 of those being considered rural. And then for children, we have 136 locations in 73 counties. It does not cover any physical health treatment, so things like diabetes, high blood pressure, those aren't being covered by Behavioral Health Safety Net. It does not cover prescriptions, but we will help connect you to prescription assistance. And then that it's not an insurance plan. Sometimes people will say, oh, I'm on the safety net. That's insurance. It's not an insurance. It's a grant program. And then here's my contact information, but I also want to share our department's helpline. So from 8 to 4:30, there are two real women that answer it, Colleen and Kathy. They also have an email address. If someone is trying to engage in mental health services, it can seem really overwhelming, even if you have TennCare or commercial insurance. And so this helpline can be helpful to people that are trying to navigate the mental health system, and Kathleen and Colleen can help kind of help them navigate it, help them get pointed in the right direction. So if you ever are working with someone that engaging into the mental health system or having issues, the department's helpline, Kathleen and Colleen, they're real people, is a great resource. And that is my spiel about Behavioral Health Safety Net. I'm trying to figure out how to stop sharing my screen.
Thank you so much. We are going to take a few questions here. There are about 4 in the chat, and I think Ms. Barker, you answered some of them, but I'm just going to go over them anyway. The first question we had was earlier in the presentations. Does the new TennCare pregnancy extension also include CoverKids for immigrants? I think the short answer was yes. Leah answered that earlier, but Leah, would you mind just kind of touching back on the qualifications and requirements?
Of course, and I'll let Emily jump in if she has anything she wants to add. So I think the question was about the extension of coverage from 60 days of postpartum to 12 months of postpartum coverage, correct?
Yes.
So unfortunately for CoverKids, it does not extend past the 60 days of postpartum coverage for pregnant women. It is only for TennCare enrollees for pregnancy coverage, correct, Emily?
That's correct. So, if it, and that's, if an immigrant is eligible for TennCare in the TennCare pregnancy category, then yeah, for TennCare pregnancy, it's been extended to 12 months postpartum and has, there's now dental coverage for pregnant women as well. But that's not true right now for CoverKids. So CoverKids is still a 60 days postpartum coverage and no dental benefits.
And I did have something I wanted to add with that. The provision in the American Rescue Plan that allowed for Tennessee to extend those TennCare coverage did include the option to expand CHIP coverage as well, or CoverKids. So that is something that Tennessee could choose to do. They just didn't include it in this expansion.
Thank you. We had a question about coverage for former foster youth. Is this only for kids who've aged out of the system or were in custody on their 18th birthday? And I think, Ms. Barker, you answered that in the chat, but could you go over it again, please?
Yeah, so you would need to have, of course, been on TennCare in Tennessee on your 18th birthday in order to qualify for this extending it to your 26th birthday. A lot of the kids that age out, they go ahead and proceed with extension of foster care. And in that program, or the independent living programs, they will make certain that that's done for them. They will make certain that, their TennCare doesn't stop because they don't really come out of the system as being a part of the DCS programs. But if they say, I'm tired of being in the system, I want to be on my own, they do need to go back in and reapply for that under former foster care youth. There's a question on the marketplace and the TennCare Connect application about that, and then it will notify them that, yeah, we do have you in the system. It's aging out of TennCare on your 18th birthday, so you do get to keep this benefit until you're 26. And those kids who are not doing the extension of foster care, you can refer them to us and we can do that application for them. But we just don't want them walking around thinking they're uninsured because they're no longer in DCS custody. They are. They just need to reapply for that benefit.
Thank you. We had a question about the Choices program for older adults in need of in-home care. Can someone talk about the qualifications?
Yeah, I can touch on that. So I think the question was just wanting to hear more about the qualifications for the Choices program. So Choices is a program that's just for adults. There's 3 levels of Choices, Group 1, Group 2, and Group 3. Choices Group 1 is nursing home level care. So you actually have to be living in a nursing home to receive Choices Group 1, and it covers the cost of your nursing home care. Then Choices Group 2 is nursing care within your home. That's the community-based services. So, but what happens when you apply for Choices is you do the full TennCare application, but also someone does what's called a pre-admission evaluation, or a PAE. And this is a 9-point or a scale where you have to score a 9 or higher in order to qualify for Choices. And they scale and they determine different parts of your what are called activities of daily living. So things like, can you feed yourself? Can you bathe yourself? Can you go to the bathroom by yourself? Can you transfer from a bed to a chair? Can you, what is your mobility? And some of those things are really difficult. So I always like to use the example of when they check to see if you can feed yourself, they're not asking, can you make a sandwich? They're asking, can you lift a sandwich from the table to your mouth? If you can, then yes, you can feed yourself is what they determine. So how you're going to get a sandwich on the table is another story. So it can be a very difficult thing to pass the PAE. But there are ways to appeal that. And there's also, you can do what's called a safety determination to say, I understand I scored less than a 9 on the PAE, but that person is not safe in the community without supports. So there are a couple ways to, if you get less than a 9 on the PAE, it's not the end of the story, but it is quite extensive. They do have someone come and evaluate your activities of daily living. I hope that answers the question a little bit more, but feel free to reach out to us if you want more information.
Thank you. And then we had one more question about ACA as a supplement to cover diabetes that the private insurance wouldn't cover. And I think the answer was
And
no.
I was saying that you cannot use the Affordable Care Act as a supplemental insurance. So I'm not quite certain why, the diabetic services were not covered under her private insurance for the first year. That's probably something that, we would have to probably look at, or she could, go to her HR or the actual insurance carrier to find out, but you cannot use the ACA as a supplemental insurance.
And a question about, I'm sorry, go ahead.
I just wanted to add a point is that that brings up a good point that the ACA is only available to people who do not have an offer of coverage through their job that's deemed affordable or deemed full coverage. So typically, if you have a job-based offer of coverage, even if you haven't taken it, you're considered ineligible for Marketplace usually.
I wanted to add one last thing, that if that coverage that the person who asked the question was referring to, if it's not through an employer, if it's just a private insurance plan that they enrolled in individually, that would be an instance where we could help them during open enrollment look to see if there was a better option through the Marketplace. So Tennessee is a state that is allowed to sell non-qualified plans through the private Marketplace, which can be really confusing for those who are able to go out and just pay for private insurance. They can be enrolled in a plan that doesn't meet the qualifying standards under the Affordable Care Act that Sharon referred to. So if you're enrolled in a individual private plan, not through an employer, that does not feel like it's meeting your medical needs, you can connect with us to see if we can find you something better during open enrollment.
There was a question about a partner navigator in Wilson County, and Ms. Baker, you answered that.
We've already connected. Okay. She already emailed me,
okay.
And we've been emailing back and forth. So I'm just really glad and excited about that.
Okay, and let's see. I think that's it. Someone asked about handouts and flyers and all that good stuff, and that was answered. They'll be emailed with a follow-up email with the certificates. So did anyone have any questions that they've thought of while we were talking just now?
I just want to add a question, a comment to the handouts and flyers. If you don't get handouts and flyers you're specifically looking for, or you need additional languages from more than the ones that we send out with the slides, just contact one of us and we'll be happy to get you some more either hard copies or digital copies.
Thank you. Well, I'm Gwen Wright. I'm the regional coordinator for TCCY in Memphis and Shelby County. And on behalf of all of the other regional coordinators, I want to thank our presenters today for sharing this valuable and relevant information. I know sometimes TennCare and Get Covered can seem really mysterious to people. So it's nice to have a presentation like this and to see the actual people who are working with that. We know that this will help our presenters as they assist the families that they work with. I want to thank Bill Latimer, who is TCCY's tech guy, for helping us navigate the technical aspects of today's training. And lastly, but certainly not least, thank you to all of the participants for joining us today. Again, you'll receive an email in a couple of weeks that will have a link to the recording of this training. If you requested CEUs or certificates of attendance or participation, that will be attached to that email as well. And I don't know about you all, but it's been a gloomy, rainy, cold last few days here in Memphis. And today the sun is out and it's blue skies, and I think that's holding true across the state. So you all have a great weekend and just stay healthy and take care. And join us next time at our next trainings, and you'll get information about that as well. Bye-bye.
Everybody.
What'd you say, Miss Jerry?
Job, everybody. We
Do we
kept
still
steady
have
about
folks?
200.
What's that?
We kept steady at about 200.
It was a
lot
really
of
good presentation. It was really good.
Yeah, but I'm going to be honest. I can't digest all that, you know.
Well, but that's why it's good to have the recording and some
Ooh,
people
I'm
that
telling
can
you,
know
that was a
now that you
lot.
can ask about it. Yeah. But TennCare is always just mysterious, you know.